Before I enter my patient's room, I make sure to have my goggles and mask on. Let's go ahead and perform 20 seconds of hand hygiene. Alright, hi there, Mr. Jones. My name is Nicolas Nguyen. I'm going to be your nurse for today. I know you can't talk right now because there's a trach inside of you, so just give me a thumbs up for yes and a thumbs down for no. If you feel any pain or discomfort, just raise your hand and let me know. Does that make sense to you? Thumbs up? Alright, perfect. Is your name John Jones? Thumbs up. Is your birthday on December 1st, 2002? Another thumbs up. Alright, let me go ahead and scan that wristband. Beep! Okay, looks like that matches our records. I noticed you don't have any allergy wristbands on you, but I just want to double check with you personally. Got any allergies? Thumbs down. Alright, love to hear it. So today we're going to be doing a quick tracheostomy care for you. Has this ever happened to you before? Thumbs up. Okay, now your first rodeo, huh? Okay, so just to make sure we're on the same page, I'm going to be doing some suctioning if I need to. I'm going to be also cleaning and assessing your trach site, changing your inner cannula, which is that tube inside your trach, the stabilizer, which is the tie around your neck, and your dressing. Before I begin, I'm just going to make sure I have all my equipment that I'm going to be needing, as well as the emergency equipment in case something goes wrong. The emergency equipment entails having an ambu bag connected at 100% O2, a suction catheter connected to the wall, to the suction I meant, 2 trachs, one the same size as the patient. Okay. Huh?
I'm gonna start.
Let me start.
Let's try again.
Yeah. Alright, so before I begin, I make sure I have goggles and a face mask on. Alright. Pardon the intrusion, Mr. Jones. My name is Nick. I'm going to be your nurse for today. I know you can't talk because you have a trach inside of you, so just give me a thumbs up for yes and a thumbs down for no. If you feel any pain or discomfort, just raise your hand to let me know. Does that make sense to you? Thumbs up? Okay, perfect. Is your name John Jones? Thumbs up, okay. And is your birthday November 18th, 2001? Alright, another thumbs up? Okay. Let me go ahead and scan your wristband, make sure it matches up. Beep. Alright, looks like that does match up with our computer records. I know you don't have any allergy wristbands on you, but I just want to double check with you personally. You got any allergies? Thumbs down. Okay, love to hear it. So today I'm going to be doing some trach care for you. Are you familiar with this? Thumbs up? Okay, not your first rodeo, huh? Alright, just to make sure we're on the same page, some trach care includes having some suctioning if we need to, cleaning and assessing your site, changing your inner cannula, which is that tube inside your tracheostomy, as well as the stabilizer, which is that tie around your neck, and your dressing. Before I begin, I'm just going to do a quick check of your room, make sure that I have all the emergency equipment we need in case something goes wrong. We got your ambu bag connected to 100% oxygen. We have a suction catheter right here connected to the suction on the wall at 120 millimeters of mercury. We have 2 trachs, one the same size as the one inside of you already, and another one size smaller. And we have another additional inner cannula as well as another suction at bedside. So before I went into your room, I made sure to double check your vitals that were documented earlier. It looks like your respiration rate's pretty high at 25 respirations a minute, and your O2 stats are a little bit low at 90%. Are you having any trouble breathing or difficulty or shortness of breath? Thumbs down? Okay. Are you in any pain right now? Another thumbs down. Okay, so if you don't mind, I'm going to go ahead and take a quick listen to your lungs. Yeah, sounds good. Okay, I made sure to sterilize this before I entered your room, so it'll be okay. Go ahead and take a deep breath in and out, 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 in and out. Okay, so I did hear some mucus and secretions that built up inside of your lungs. So we're definitely going to be doing some suctioning today to clear out that airways. Just to go over what we're doing one more time, make sure we're on the same page. We're going to be suctioning out your secretions, cleaning and assessing your trach site, as well as changing your inner cannula, stabilizing, and dressing. Got any questions or concerns before we begin? All right, perfect. Let me go ahead and close that curtain to give us some privacy, and put your high flowers. Let's go ahead and perform 20 seconds of hand hygiene once more. And put on some knee gloves. I'm just going to go ahead and start wiping now. So I noticed a lady come into your room a couple days earlier today. Was that your wife or a relative? Thumbs up. I'm guessing your wife, just because she didn't look like you that much. Another thumbs up. Oh, she's so nice of you to visit. Or is that so nice of her to visit? Were those her orchids that she brought by? Yeah, they're really pretty. One more time, wiping the sides. Okay, let's go and discard this. Perform 20 seconds of hand hygiene once again while I wait for this to dry for 2 minutes. I'm going to double check that you're in high Fowler's. Alright, now that the 2 minutes have passed, I'm going to go ahead and get my supplies. Let's go ahead and grab that now. Go sterile water. It's going to be here. I'm going to put the cannula here. 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 And here. Okay, I'm going to perform 20 seconds of hand hygiene once more. Put some new gloves, and the next thing I'm going to do is change out that catheter of yours that's on the bedside at the moment. Just because I don't know when the last time someone changed it was, so I'm going to play it safe and do it right now for you. Alright, so to do that, I'm going to be taking the catheter kit, opening it. While I'm here, I'm going to go ahead and take out the sterile box I'll be using. Place it nice and far away from me to make sure I don't hover over it ever. Let's go and take out the new catheter. Change out the old catheter. Looks like it's a little bit tangled right now, so I'm just going to take care of it right now. Let's make sure that the tip stays inside the plastic. Alright, that works. Alright, tip always stayed inside the plastic, so it's nice and sterile. Okay, let's go ahead and get that old catheter and discard it. Now let's go ahead and discard these gloves, perform 20 more seconds of hand hygiene, and prep our trick kit now. Doing okay so far? I know I've been in your room for a little bit, huh? Need some peace and quiet at this rate? Don't worry, I'll get out of your hair in a couple minutes. Next thing I'll be doing is prepping your trig kit like I said. So let's go ahead and open it up. We'll not be needing these sterile gloves. This procedure. Next thing I'll be doing is grabbing your drapes using the 1-inch border. Make sure it stays nice and sterile. Okay. So I'm checking both sides. It looks like the shiny side is facing away from me. I'm going to be placing the shiny side onto your body, just like so. Alright, next thing I'll be doing is getting my ink cannula and placing it over, just like so. I'm going to discard this. Let's get our sterile box. Make sure not to hover over the kit at all. Alright, next thing we'll be doing is getting the saline water that is sterile, and then pouring it into this, and pouring it into the well. Let's go ahead and get some new gloves out. Perform 20 seconds of hand hygiene once again. And I'll be prepping you for suctioning soon. Doing okay still? Yeah? Okay. So next thing I'll be doing is checking out how that new suction catheter I just put in is doing. Let's go ahead and grab that. Move the plastic covering out the way. Alright, looks great, looks great. Looks like it's suctioning really well. Okay, next thing I'll be doing is providing you some oxygenation before we begin. So how we're going to do that is I'm going to grab your faceplate, keep it nice and stable. Alright, looks like it touched the 1-inch border, but not the actual sterile area. So let's go ahead and provide you one breath every 6 seconds, 3 times. 1, 2, 3, 4, 5, 6. 1, 2, 3, 4, 5, 6. 1, 2, 3, 4, 5, 6. Okay. Looks like your O2 sats went a little bit up from that. That's great news. That makes me more relieved. Now that we can go ahead and start suctioning. So let's make sure we don't touch those drapes because that part is nice and sterile. I'm going to go in for 4 seconds and then go out 6 seconds, okay? I'm going to go ahead and start now. 1, 2, 3, 4. Alright, let's go and pull that out. 1, 2, 3, 4, 5, 6. Alright, let's go ahead and clean this in the sterile water. Okay, let's go ahead and put the plastic covering back on top of the tip and put that away. How are you feeling? I noticed you did have a couple of a lot of secretions come out there. You had some coughing. Did okay? Okay. Alright. Looks like your O2 sats are back up again. 99%. Respirations we're at 18 the last time I counted. You're doing great. Doing great. Let's go ahead and discard this box that I don't need anymore. Take off these gloves. Perform 20 seconds of hand hygiene. And get that inner cannula for you. Okay. Next part is coming right up. I will be taking out your face mask. Well, not face mask, but your oxygen mask once again. I'll hold it down first and get that inner cannula out for you. Make sure to only touch the wings for this part because the rest is going into your body. I'm going to make sure it stays nice and clean. So first thing I'm going to do is take this one out using the wings, like I said. Let's go and discard that. Alright, now I will grab this one using the top only. Alright. Go ahead and insert it. Like I said, let's only use the top. Let's go ahead and clip that in, just like so. Alright, next thing I'll be doing is removing your dressing. Alright. Now that that is gone, I'm going to do a quick assessment. I don't see any signs of irritation, swelling, or redness. I don't see any signs of pressure wounds as well. Your trach is looking nice and intact, no cracks. All great news for you, by the way. Alright, let's go ahead and clean that out for a little bit. First swab goes in the well. Now it's going to go under first, just like so. Next one is going to go over. Just like so. And we're going to get some gauze out. This is also going to go in the well. This one goes under once more. Just like so. Alright. Doing okay still? Thumbs up? Alright, great, great. Doing great, Mr. Jones. This one goes above again after dipping it into the well. Okay. This one is going to be used to pat your face mask. Make sure that area is clean as well as the skin surrounding it. Okay. This last one is going to be used to just dry the area. Make sure that it stays nice and dry, just like so. Last one is going to be used to go underneath your faceplate. Oh, sorry about that. Alright, let's get this around. Like so. Okay, dressing is back on. That wasn't too bad, right? Love to hear it. No pain. Okay, no pain. Okay, let's go ahead and get the drape off now that we don't need it anymore. Let's go discard of it as well as our trach kit. I'm going to go ahead and start prepping for your stabilizer. I'm gonna go ahead and discard my gloves. Perform hand hygiene at this point. So for this next part, I'm gonna need another nurse. So I'm just gonna step out the room for a couple minutes. While I do so, I'm gonna put your bed in the lowest position. I'm just gonna put the side rows up and get a call belt in place for you in case you ever need me. I'll be right back, okay? Hi, Mr. Jones. Thanks for waiting a little bit. I brought Janet with me to help me take off your neck stabilizer. Say hi, Janet.
Hi, Mr. Jones.
So we're just gonna go ahead and perform 20 seconds of hand hygiene and then put on some new gloves again. Anything happened while we were gone? Were you in any pain? Thumbs down. Alright, love to hear it, love to hear it. So, once I take off that O2 mask of yours, Janet's going to put her 2 fingers on and keep it stable while I take off your old stabilizer. Okay, can you go ahead and put your fingers there? Thank you very much. Let's go ahead and take this off and then take off your stabilizer. Alright, like I said before, if you're ever in any pain, let me know and we'll take a break. Okay. Just going to do a quick assessment of the neck, of my side of the neck and the back of your neck, if you could raise it for me, please. It looks like there's no signs of any redness, irritation, or swelling. I also don't see any signs of any pressure wounds or infection. So that's all great news for you. Alright, go ahead and keep that neck raised for me if you can. Just going to go ahead and slip this underneath to Janet's side. And then stick this on through. Alright, Janet, whenever you're ready, I can hold down that faceplate for you. Alright, and take off your side. If you'd also let me know if you see any signs of redness, irritation, swelling, infections, or pressure wounds while you're there.
Looks good on my side.
Okay, love to hear it, love to hear it. Alright, let's go ahead and, can you hold the faceplate down for me one more time? Let's go ahead and get this back on you. Then put your O2 mask back on. Alright. I'm going to do a quick 2-finger check, see how loose it is, how tight it is. Thumbs up? Alright, that's great to hear. Alright, Janet, let's go ahead and take off our gloves, perform hand hygiene for 20 more seconds. You're good to go and do whatever you need to do now. Thanks for your help. Alright, so that wasn't so bad, right, Mr. Jones? No pain? I'd love to hear it. I'm just going to do a new set of vital signs before I go. Alright, looks like your O2 sats are still at 98%, and the respirations are at 18 breaths per minute. So it looks like the suctioning helped with that. I'm just going to go ahead and take a quick listen to your lungs one more time, see how they're doing. Alright, deep breath in, out, in, out. In, out, in, out, in, out, in, out. Okay, lungs sound great as usual. Don't hear any secretions or mucus in there anymore. Just gonna go ahead and make sure all your emergency equipment is in place again, like your ambu bag at 100% oxygen. Your suction catheter is attached to a suction at the wall. The extra inner cannula and suction catheter, as well as 2 trachs, one size smaller than the one that you have inside of you right now. I'm going to make sure that your suction catheter is above your bedside again, where it can be kept nice and clean. I'm going to put your call bell right here next to you in case you ever need me. Let's go ahead and put your bed in the lowest position. And let's also put the side rails up. Alright, I'm going to perform hand hygiene one more time. And step out. Once I'm outside, I'm going to go ahead and document a couple things, including the date, the time, the patient tolerance, the peristomal site assessment that I did, the sputum secretions, including the color, amount, and consistency, the patient's vital signs, O2, especially O2 sats, and pain and respiratory assessments before and after the procedure.